Bismillahirrahmanirrahim. Assalamu alaikum. Very good morning. I hope you all students will be fine. So today's topic is antifungal drugs. As the topic is lengthy, so it will be divided into two halves. First part will be covered inshallah today, and second part will be covered inshallah ta'ala tomorrow. So, what are the learning objectives of today's topic? Learning objectives are actually the learning outcomes which you should be remembered at the end of the topic. Classify antifungal drugs. First of all, classification of antifungal drugs. Then describe the mechanism of action of amphotericin B. Describe the spectrum of antifungal activity of amphotericin B. Describe uses and adverse effects of amphotericin B. Describe the mechanism of action of flucytosine and list clinical uses and adverse effects of flucytosine. Next, describe mechanism of action of echinocandins. Describe uses and adverse effects of echinocandins. First of all, classification of antifungal drugs. So I will classify into two types according to the treatment which we will do to the fungus and according to the mechanism of action. First of all, I will classify according to mechanism of action. According to mechanism of action, this classification is present. They alter the cell membrane permeability or they change the permeability of cell membrane. There are three classes of this which change the permeability of the cell membrane: azoles, polyenes, antibiotic, antifungal drug, which is in this group amphotericin B is included, then terbinafine. Next, the antifungal drug which block the synthesis of nucleic acid, in which flucytosine is included. Next, the antifungal drug which disturb the microtubule functions, in this group graciophulvin is included. Next, classification of drugs according to the treatment. Drugs for systemic fungal infections, which we use in the case of systemic fungal infections. These drugs are present: amphotericin B, flucytosine, azole antifungals, and echinocandins. Next, drugs which are present for superficial fungal infections, but they should be taken orally. Systemic drugs for superficial fungal infections, they may be taken orally. Glycophyll, terbinafine, and azoles. Next, topical drugs for superficial fungal infections. The drugs in this class include nystatin, miconazole, and clotrimazole. And there are other also topical creams, antifungal creams, and this antifungal cream also come in combination with antibiotic for topical use. And now look at some pictures of fungal infections. This it is fungal infection present in the scalp. In this case, only topical drug will be not effective. Physician will prescribe as well systemic antifungal drug. Next, it is typical fungal infection ringworm. In this case, fungal infection center is clear and there is border of that ringworm and center is clear. This is typical fungal infection ringworm. Next, this is fungal infection pyronychia. This is fungal infection which is present between the fingers of foot, between the toes of foot, and it is also known as athlete's foot. It may occur due to sweating, due to wet, uh, due to any wet element present between the toes. Now, first of all, I will discuss amphotericin B. Amphotericin B is the polyene antibiotic. This drug is poorly absorbed from the GIT, so it should be given IV, and it is given in case of systemic fungal infection. Mostly, it is given IV in the form of colloidal suspension as a lipid complex or in a liposomal formulation. Elimination of this drug is via slow hepatic metabolism. That drug is widely distributed to all tissues except the central nervous system. The half-life of that drug is approximately 2 weeks. A small fraction of the drug is excreted in the urine, so dosage modification is necessary only in extreme renal dysfunction. The mechanism of action of amphotericin B. That drug bind to ergosterol, a sterol specific to fungal cell membrane, and cause the formation of artificial pores. The pores disturb the membrane function, allowing electrolytes and small molecules to leak from the cell, resulting in death of the cell. Resistance to this antifungal drug can occur due to structural change in the membrane ergosterol. Now the antifungal spectrum and uses of amphotericin, it is widest antifungal, it has widest antifungal spectrum. It remains the drug of choice for most systemic infections include Aspergillus, Blastomyces, Candida albicans, Cryptococcus, Histoplasma, and Mucor. It is used for the treatment of systemic mycosis. It is used for initial induction regimes before follow-up treatment with an azole. It is given by slow IV infusion, but in fungal meningitis, intrathecal administration is also being used. Local administration of the drug has also been used in the treatment of mycotic corneal ulcers and keratitis. Now, in this picture, candidiasis has been shown. Adverse effects of amphotericin B. Infusion-related adverse effects include fever, chills, spasm of the muscles may occur, vomiting, there may be fall in blood pressure. These effects may be counteracted by slow infusion rate and by pre-medications with antihistamines, antipyretics, and glucocorticoids. And the next adverse effects of amphotericin B, the dose-limiting adverse effects of amphotericin B. Amphotericin decreases the glomerular filtration rate and causes renal tubular acidosis. Anemia may result from decrease in renal formation of erythropoietin. Nephrotoxic effects of the drug are dose-limiting and concomitant saline infusion. It may reduce the renal damage. So that drug is nephrotoxic, and whenever that drug should be used, saline infusion should also be used with this drug to prevent renal damage. Dose reduction is also possible in infections when amphotericin B is used with flucytosine. Next drug is flucytosine. So what is flucytosine? It is the pyrimidine antimetabolite. It is given orally, it distributes to most body tissues, it is eliminated intact in the urine. As it is eliminated intact in the urine, so dosage modification should be necessary in cases of renal insufficiency. Now the mechanism of action of flucytosine. Flucytosine is accumulated in the fungal cells by the action of the enzyme permease. In fungal cells, flucytosine is converted by dicytosine deaminase to 5-fluorouracil. 5-fluorouracil is actually the inhibitor of thymidine synthase, thus it inhibits the synthesis of protein. Resistance can occur rapidly if flucytosine is used alone and involves decreased activity of fungal permeases. Uh, Whenever there is decreased activity of the enzyme fungal permease, then resistance can occur with flucytosine. When flucytosine is given with amphotericin or azoles or like with triazoles, resistance is decreased. Why resistance is decreased? Because synergistic antifungal effects will be occur. Uses of flucytosine, it has synergistic action with amphotericin B. It is used in cases of Cryptococcus neoformans. It is used in cases of systemic candidal infections. It is also used in cases of chromoblastomycosis. Adverse effects of flucytosine include it has reversible, with the use of this drug, reversible bone marrow depression may occur. Alopecia may occur with the use of this drug. Liver dysfunction may occur with the use of flucytosine. Next drug is echinocandins. Uh, the drugs includes in this class are caspofungin, anidulafungin, and micafungin. Now, the mechanism of action of echinocandins, that drug is used mostly intravenously through IV route. Elimination is via hepatic metabolism. The mechanism of action of echinocandins is that it inhibits glycan synthase. So thus it decreases the synthesis of fungal cell wall. Now the assignment for today is explain the mechanism of action of amphotericin B. Now the uses of echinocandins include it is used in cases of disseminated and mucocutaneous candida infections. It is used in case of mucormycosis. It is also used in cases of esophageal and invasive candidiasis. It's also included in case of mucocutaneous candidiasis. It is also used in prophylaxis of candida infections in bone marrow transplant. Now, what will be the adverse effects of echinocandins? Adverse effects of echinocandins include GIT distress, headache, fever, rash. Flushing may occur with the use of this drug due to the release of histamine, and that drug may elevate the level of certain immunosuppressant drugs.